To start on gender-based violence, I'm looking at my colleague Kinshasa. Good morning, madam. Can you brief our journalists on the situation? Much. We have online Shelley Thakral from...
Allegedly is behind the M23 offensive. Thanks.
C'est la même média, pas la même personne. Pardon, Agnès.
Pas de souci.
The suspension of food assistance in DRC, in Goma, specifically.
Dr. Marshang?
Yes, thank you.
The humanitarian situation in and around Goma remains extremely worrying. And again this morning, our colleagues in the Democratic Republic of the Congo report heavy small arms fire and mortar fire across the city and the presence of many dead bodies in the streets. We have reports of rapes committed by fighters, looting of property, including of a humanitarian warehouse, and humanitarian and health facilities being hit. Hospitals in Goma are reportedly overwhelmed, struggling to manage the influx of wounded people.
The humanitarian crisis in the DRC has further deteriorated since our last briefing to you on Friday, with now nearly 500,000 people displaced in North and South Kivu provinces in January alone. Hundreds of thousands have been forced to flee multiple active conflict zones, and the capacity to accommodate and assist them is now saturated.
There are currently hundreds of people in hospital, most admitted with gunshot and shrapnel wounds. Secondary infections become a health risk. WHO is especially worried for the health and safety of women and girls who are at the higher risk of violence, including rape. Pregnant women are at risk with very high maternal death rates, even before this recent escalation of violence. Capacities to deal with the newly injured are stretched, and WHO is working with authorities and partners to identify solutions and to increase local capacities to deal with this.
The next 24 hours will be critical as people start to run low on supplies and will need to see what they can find to survive.